In the name of God, hello everybody. I hope you are doing well and safe. And in this topic, we are going to talk about the um, anatomy of the digestive system. As you know, the anatomy of an anterior abdominal wall is clinically very important due to the reasons such as the physical examination of the abdomen is mostly performed through the anterior abdominal wall, and access to the abdomen and its contents is usually obtained through the incision in the anterior abdominal wall. And abdominal, and as you know, abdominal hernias must occur through the anterior abdominal wall. Thus, in this section, at the first, we are going to talk about the anterior abdominal wall. As you know, the anterior abdominal wall is a muscular aponeurotic structures confined to the anterior and lateral aspect of the abdomen. And it is bonded by the xiphoid process and xiphoid process and the right and the left costal margin, as you know, and below by the anterior part of the iliac spine, anterior anterior part of iliac crest, and the fold of Grion and the pubic tubercle and the pubic crest and the pubic symphysis, as you know. And on each side it is separated from the posterior abdominal wall by the mid-axillary line. Thus, above we have xiphoid process and costal margin on right and left side, and inferiorly we have iliac crest and inguinal ligament and pubic tubercle and pubic crest and pubic symphysis. And on each side the anterior abdominal wall is separated from the posterior abdominal wall by the mid-axillary line, as you know. And then, how about the abdominal cavity boundaries? Abdominal cavity. Anterolaterally, we have a musculo-membranous structure as the anterolaterally wall of the abdominal cavity, and superiorly we have a diaphragm, and inferiorly we have a pelvic inlet or pelvic brim, as you can see in this picture. And now we are going to talk about the surface landmarks of anterior abdominal wall. The surface landmarks such as coastal margins and umbilicus and anterior superior iliac spine and iliac tubercle and are important guides, are important landmarks in orienting the clinicians to the location of the viscera in the abdominal cavity, as you know. Thus, we needed to know the landmarks of abdominal wall to for mm, for to find other structures, other important structures such as organs and nerve and arteries of abdomen and systems. Coastal coastal margins are bony landmarks of anterior abdominal wall, as you know. This one is coastal margin. The cartilage of the seventh and the eighth and nine and 10, the ribs form coastal margin, as you know, and the right and left coastal margins run upward, as you can see, upward and medially toward the side of xiphoid process and xiphoid process, as you can see in this picture. The coastal margin reaches its lowest level in the mid-axillary line. This one is the lowest level is the lowest level of coastal margin in the mid-axillary line. And another landmark of anterior abdominal wall is the xiphoid process. It lies at the apex of a subcostal angle, and its apex is sometimes forward and easily palpable beneath the skin. We can palpate the xiphoid process. Xiphoid process. The xiphoid process lies at the level of the ninth thoracic vertebra, as you know, and you can see in this picture. Another landmark of anterior abdominal wall is iliac crest. Iliac crest. Iliac crest. It forms the lower limit, as mentioned earlier. It forms the lower limit of anterior abdominal wall at side and can be traced forward to anterior superior iliac spine. And as you can see in this picture, the highest points of iliac crest, lie at level of the fourth lumbar vertebra, just below the level of umbilicus. As you can see in this picture, this one is umbilicus, and this one is iliac crest. The highest point of iliac crest, we have the highest point of iliac crest at the level of the fourth lumbar vertebra. And another landmark of abdominal anterior abdominal wall is symphysis pubis, as it forms the lower limit of anterior abdominal wall in anterior median plane, and it is easily palpable and lies at the level of coccyx, as you can see in this picture. And how about the soft tissue landmarks? One of the soft tissue landmarks of anterior abdominal wall is umbilicus. And it is an irregular depressed area in midline, depressed midline, and a little below its midpoint, at the level of the between the third lumbar vertebra and the fourth lumbar vertebra. As you can see in this picture, we have umbilicus between the third lumbar vertebra and the fourth lumbar vertebra. And another and in abdominal wall, anterior abdominal wall, we have a Morphy's point. Morphy's point. It is a point at. It is a point at the. It is a point at a junction of the. At a junction of the one third, at the junction of medial 2/3 and lateral, one third of the line, extending from umbilicus and umbilicus extend from the umbilicus to anterior superior iliac spine, as you can see in this picture. At the base, at this point, we have the base of the appendix that lies deep to this point. And thus, we a McBurney's point, as you can see in this picture, between the one third laterally one third and medially 2/3 of the line between the umbilicus and the anterior superior iliac spine. Here is umbilicus, and this one is anterior superior iliac spine, and this point is McBurney's point. McBurney's, the base of the appendix lies deep to this point. And how about the Morphy's point? Morphy's point. As the same of the McBurney's point, to find the appendix, we have the Morphy's point to find the gallbladder. And it corresponds to the tip of the ninth costal cartilage. The tips of the ninth costal cartilage, and the fundus of gallbladder lies deep to this point. And now we are going to find the abdominal planes such as transpyloric plane and Edison plane and costal plane. Transpyloric plane and Edison plane. It is and horizontal or transverse plane which pass through the midpoint of the line joining the jugular or supraesternal notch to the symphysis pubis. Okay, thus we have the transpyloric plane between the jugular notch of sternum and the symphysis pubis, and it lies at the first lumbar vertebra, as you can see in this picture. The first lumbar vertebra. And how about the subcostal plane? As you can see in this picture, it is horizontal plane, and it passes anteriorly. It passes through the lower border of costal margin, lower borders of costal margin, costal cartilage of the 10th and costal margin, and posteriorly through the body of the third lumbar vertebra, as you can see in this picture. And in anterior abdominal wall, we have a transtubercular plane and that passes posteriorly through the 5 lumbar vertebra, as you can see in this picture. All right, these planes are used. These planes, such as transpyloric plane and subcostal and transtubercular, are used to describe the 9 regions or 4 quadrants of the abdominal cavity for description the regions of abdominal cavity, which the clinicians refer to describe the location of the abdominal viscera and pain abdomen. In this picture, you can see the regions of the abdomen that are formed by the planes, such as the subcostal planes, intertubercular planes, transpyloric planes, or left lateral plane and right lateral plane. All right, now we are going to describe the topographic divisions of the abdomen by the planes, as mentioned earlier. We have a 4 quadrant pattern, as you can see in this picture, and a 9 region pattern in this picture. 4 quadrant pattern is formed by the a horizontal transumbilical plane and a vertical median plane. And thus, we have four quadrants, such as the right upper quadrant, left upper quadrant. As you can see in this picture, for example, we have the liver in right upper quadrant, and we have stomach in left upper quadrant. And how about the nine region patterns? In this pattern, we have two vertical planes and two horizontal planes. The vertical planes are the midclavicular planes, and the horizontal planes are the transpyloric planes or and and you can, as you can see in this picture, the horizontal planes are transpyloric plane and transtubercular plane, and thus we have nine region. As you can see in this picture, now we have a nine region. That are named as right hypochondrium, left hypochondrium, right flank or right lumbar region, and left flank region or left lumbar region. As the lowest part is right gerion and the left gerion or right iliac fossa or left iliac fossa. And in midline, we have the epigastric region around the stomach, and umbilical region and pubic region above the pubic symphysis or pubic region or hypogastric region. Hypogastric region. We use the nines or four region pattern for description for the describe the location of the abdominal viscera and the and abdomen and the abdominal pain and abdominal pain. And now we are going to talk about the abdominal walls layers. The anterior abdominal wall is firm and elastic, okay, and it consists of eight layers. Eight layers. And that is from superficial to deep. These are skin, superficial fascia, and muscles of the anterolateral wall of the abdomen, such as the external oblique muscle and internal oblique muscle and transverse abdominis, and extra peritoneal and transverse transversus and the fascia transversalis and extraperitoneal fascia, and the deeper layer is a parietal layer of peritoneum. Parietal layer of peritoneum. All of them are the layers of the anterior abdominal wall. Skin of anterior abdominal wall is thinner and most sensitive than the skin of the posterior abdominal wall. And hmm, And we have a cutaneous nervous of anterior abdominal wall, as you can see in this picture. Mm, In this picture, you can see the cutaneous nervation of the anterior abdominal wall by the seventh thoracic nerve to the 12th thoracic segment of the spinal cord and the first lumbar segment of spinal cord as the hypogastric nerve and ilioinguinal nerve. As you can see in this picture, the skin around the umbilicus is supplied by the 10th spinal segment. Okay, and therefore the visceral pain of appendicitis is referred to umbilicus, as you know. Note the appendix is supplied by the 10th spinal segment as the same the skin around the umbilicus. Thus, the visceral pain of appendicitis is referred to the umbilicus. And in this picture, you can see the arteries of the anterior abdominal wall, and you can see the superior epigastric artery as the main artery of the abdominal for upper part of the abdominal wall, and we have the inferior epigastric artery for the lower part of the anterior abdominal wall. And how about the superficial fascia of the anterior abdominal wall? The superficial fascia contains a variable amount of fat, and the maximum in the lower half of the anterior abdominal wall. And as you know, the anterior abdominal wall is the major site of fat accumulation, especially in the female, leading to the obesity. And above the level of the line joining the two anterior superior iliac spines, the superficial fascia consists of a single layer, but below this line, it consists of two layers. Here consists of two layers of superficial fascia. A superficial fatty layer as Camper's fascia, and a deep membranous fascia layer of fascia as Scarpa's fascia. In this picture, you can see the fatty layer of superficial fascia as Camper's fascia, and you can see the membranous layer of the superficial fascia as Scarpa's fascia. Scarpa's lies below the Camper's fascia and is deeper, as you can see in this picture. Over the penis, sorry. In this slide, we summarize the superficial fascia, layers of superficial fascia. Above the umbilicus, we have a single layer of superficial fascia, but below the umbilicus, we have two layers, fatty superficial layer as Camper's fascia and membranous deep layer as Scarpa's fascia. And in men's, the superficial layer continues over the penis, and mm, it is devoid of fat, and in the scrotum, in the scrotum, it is replaced by and involuntary dartus fascia or datus muscle in some texts as dartus muscle. Okay, and in women, this superficial layer retains some fat, and it and is a component of the labia major. Okay, and the membranous deep layer, the deeper membranous layer as scarpas of superficial fascia is thin, as mentioned earlier, and membranous, and contains a little or no fat. No fat. And the scarpas layer over the penis, the scarpa's layer is box fascia, as box fascia, and it covers the scrotum, and it covers the scrotum as the Cole's fascia, as the Cole's fascia, as the cold fascia. And in women, the membranous layer continues into the labia major and the anterior part of the perineum. And in this picture, you can see the scarpa's fascia over the penis as the buck fascia, and in scrotum as and in scrotum and in perineal membrane as the Cole's fascia, and in scrotum as a dartus muscle. Okay. All right. Until now, in this session, we described the anterior abdominal wall landmarks and abdominal wall layers such as skin and superficial fascia. Another layer of the anterior abdominal wall are muscles and fascia, and thus. As you know, we have limitation for uploading the file. Just that's enough for this session, and that in the next session we will talk about the muscles of the anterior abdominal wall and the abdominal cavity. Have a nice day.